Hi, I'm Dr. Trace Curry, and now let's talk about the operations. It's easiest to break these operations down into two categories. Restrictive procedures, where we just reduce the size of the stomach, and malabsorptive procedures, where we not only reduce the size of the stomach, but we also bypass some small intestine, therefore causing the patient to absorb fewer calories. We have two operations in the restrictive category, the gastric band and the vertical sleeve gastrectomy. Because these operations are overall lower risk than malabsorptive procedures, we can in some cases offer them to patients with a body mass index as low as 30. In the field of malabsorption, we have the duodenal switch, also known in our practice as the SIPS procedure, and the laparoscopic Roux-en-Y gastric bypass. First, we'll talk about gastric banding or the lap band. The lap band is the only adjustable procedure and also the only easily reversible procedure. You can see an example of the current lap band right here. It's an adjustable band with an inflatable balloon on the inside of it. We place this band on the upper part of the stomach, and when the balloon on the inside of this band gets inflated, it causes the patient to fill this part of the stomach up first. This is where most of the stretch receptors are located that send the signal of fullness to our brain. So as you can imagine, with the band in place that's properly adjusted, you can achieve the feeling of fullness without having to necessarily fill up the bottom part of the stomach down here. What are the pros and cons of gastric banding? Well, the biggest advantage of the band is that it's really the lowest risk option. It's also adjustable and reversible. The facility stay is a little bit shorter and recovery is a little bit quicker than for the other operations. You don't have to take as many vitamins after a gastric band, and for a self-pay patient, it's the most economical option. On the downside, weight loss is much slower with a gastric band than it is with the other operations. In a patient who's really performing optimally, we're going to see at the most 1 to 2 pounds per week of weight loss. This is because overall the band is not as powerful of an operation as the other procedures. So this will sometimes lead to less weight loss with gastric banding, and also especially for patients who have a body mass index over 45, we see the efficacy of the lap band trailing off quite a bit. So lap band is best for patients who have a lower BMI, certainly below 45. The gastric band is also a foreign body. Most of the complications related to the band are due to that fact. Slippage of the band is the most common complication, and this occurs in roughly 3 to 5% of patients. And this is a situation where the band slips out of position, which can lead to a lot of vomiting or heartburn issues. Typically with a slip, we will either have to remove all the saline from the band or in some cases reoperate to revise or remove a slipped band. Infection is rare, but it's a risk anytime we are putting in an implantable device. Erosion of the band is probably the most serious complication, but it's also one of the least common complications. This means that the band wears a hole through the side wall of the stomach, so that part of the band is actually on the inside of the stomach. Whenever this happens, the only way we can get an erosion to heal is to remove the band. Problems with the access port or the tubing, like a kink or a crack or a leak, are very minor and very rare, and the risk of death from a gastric band is extremely low. It's around 0.05%. Here you see the configuration of incisions for a gastric band. You'll have 5 very small incisions that are either 1/4 inch or 1/2 inch in length, with the exception of this one incision right here, which is where the port is located. A gastric band takes roughly around 40 minutes to perform, and the facility stay is about 2 hours after surgery. Most patients are back to work within 3 to 7 days, and after a gastric band, we advance your diet slowly. A patient will do 24 hours of clear liquids, 14 days of pureed foods, and then you'll be back on solid food after that. The first band adjustment is done 1 month after surgery. The reason we don't do that right away is that we use some sutures to hold the band in place on the stomach, and we need to allow some time for these sutures to heal before we adjust the band. And it's very important to point out that in order to be successful, a band patient will have to make frequent follow-up visits in the office for band adjustments, especially in the first year after surgery.